Welcome back to Season 14 of The Regimen. Joining us today is Dr. Olutosin Ojugbele, a medical director at the Rhode Island Department of Health, for a fascinating discussion on sun safety and how to protect yourself from sunburns to skin cancer. Hello, pharmacists and friends. Today is Tuesday, June 25th, 2024. Welcome to The Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues and solutions. Listen in to find out how we all can improve population health, health equity, and patient care through advocacy and education. My name's Liz Arnold. I'm a sixth and final year Doctor of Pharmacy student at the University of Rhode Island, working alongside Dr. Bratberg in the Rhode Island Department of Health.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the Ori College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
We are so excited to welcome Dr. Olutosin Ojugbele, a medical director at the Rhode Island Department of Health. Thank you so much for joining us. So can you tell us about the Department of Health and your role there?
Thank you so much for having me. And please feel free to call me Tosin. Pediatricians are pretty informal folks. So I am a pediatrician by training and still practicing general pediatrics. And I'm also the medical director of community health and equity, as well as environmental health at the Rhode Island Department of Health. So the Rhode Island Department of Health is a state agency that oversees public health services like vital records, disease outbreak responses, food and water safety, and health policy in our state, among other things. So as the medical director of community health and equity and environmental health, my job is to provide guidance on the use of medicine in public health with a goal to eliminate health disparities through collaborative work.
So we are in our first official week of summer here in Rhode Island, and we have already felt the increase in the sun's intensity in the form of the year's longest days. So we wanted to have an episode on sun safety to remind everyone how important it is to protect yourself, not only in the hot summer months, but also year-round. So can you give us an overview of what sun safety is?
Sure. Sun safety focuses on those healthy behaviors that prevent exposure to the sun's ultraviolet or UV rays that can cause damage to the skin and the eyes.
I am a person who personally, and we'll talk a little more about this, I'm very concerned about sun safety, but maybe you can tell us why is sun safety so important?
Absolutely. So it's really important because UV rays from the sun can damage our skin cells. And in the short term, that damage can cause a sunburn. But over time, that UV damage adds up and it leads to changes in our skin's texture, premature skin aging, and sometimes skin cancer, which is the most common cancer in the United States. And UV rays are an invisible kind of radiation that comes from the sun, as well as tanning beds. And nearly 5 million people in the United States are treated for skin cancer each year. It can be serious and sometimes even deadly, and the cases of skin cancer continue to increase in the US. But fortunately, skin cancer can be prevented, and sun safety is a really important part of that.
Yeah, I've heard many stories of either people coming into the pharmacy. I work in community pharmacy here in Rhode Island. And also friends and family members talking about skin cancer, preventing it, even getting spots removed. So for whom it is most important, where should we be focusing health promotion efforts?
Yeah, I really want to impart that skin cancer can affect anyone, regardless of your skin color, but there are certain people with characteristics that do put them at greater risk. So, for example, those people with skin that burns, freckles, reddens easily, or easily becomes painful in the sun, folks that have certain types or large numbers of moles on their body, if they have a family history of skin cancer, or a personal history of skin cancer, and then our older adults. That's also a concern in terms of who has the greatest risk. I do also want to point out that racial and ethnic health disparities do exist in the diagnosis and the management of skin cancer, and that leads to poorer outcomes for certain populations. So, for example, non-Hispanic white patients make up the majority of skin cancer cases, but those from racial and ethnic minority groups have poorer prognoses and outcomes.
And I'm guessing that's because, like you said, it's a delay in diagnosis, or are there different beliefs in terms of how dangerous the sun is for some of those populations, or a difference in just knowledge and other things like that?
So I don't think we have any research that, currently supports that, although this is, evolving in terms of the exact causes of some of these disparities. But like other disparities that we know of, for example, maternal health, we have seen an evidence in terms of how patients are treated based on their racial and ethnic identity, and that, of course, affecting their health outcomes.
Thank you so much. Very important to know. So, okay, let's get to some solutions. So besides assessing your risks for sun damage, what are the key things that our listeners can do to stay safe?
So a couple things. The sun's rays are strongest between 10 a.m. and 4 p.m. So really important to consider the timing of when you're outside on those particularly hot days. Wearing protective clothing like longer sleeves, wearing a hat, as well as wearing sunglasses to protect your eyes from UV rays, which can reduce the risk of cataracts. Next, sunscreen. So sunscreens are assigned a protection factor, SPF, sun protection factor, that rates how well they filter out UV rays. And the American Academy of Dermatology recommends SPF 30 or higher, while the CDC recommends at least an SPF of 15. Really important to remember to reapply your sunscreen. It wears off. If you're out in the sun for more than 2 hours, you need to be reapplying. You should also be reapplying after swimming, sweating, or toweling off. Always remember to check your sunscreen's expiration date. It has no more than a shelf life of 3 years. And then, as a pediatrician, I do have to plug that sunscreen is not recommended for babies who are 6 months old or younger. So it's important to keep infants out of the sun during the midday or using protective clothing.
Yeah, those are all great pieces of advice that I try to tell my children all the time, but I'm a bad pediatric parent, I guess, here. But I do my best. Just yesterday, they were out in the sun, and I said, "Did you put sunscreen on? You're outside all day." They're like, "Yep." "Did you put some on your face? Because it looks a little red." "Nope." "Okay, well, your face has skin, honey, so you need to do that." But that might just be teenagers. So there's lots and lots of different kinds of sunscreen. You mentioned about reapplying after toweling off, and you see these things that are waterproof or water resistant, and there's sprays and lotions and chemicals and minerals, and then there's people's desire to, see it or not see it. Like, could you tell us a little bit about those differences or what really matters besides the SPF?
Absolutely. So first, let's talk about mineral versus chemical. So the way that mineral sunscreen works is that it acts as a physical barrier against the sun's rays. So this is because this type of sunscreen actually sits on the surface of your skin, and it reflects and scatters the UV rays away from your skin. While chemical sunscreen contains chemical ingredients, and it provides sun protection by these chemicals absorbing the sun's rays and preventing them from reaching your skin. When we talk about waterproof versus water resistant, there's actually no such thing as waterproof sunscreen. Sweat and water wash sunscreen away from our skin. So the FDA actually doesn't allow manufacturers to claim that a sunscreen is waterproof. It's just not true. However, some sunscreens are water resistant, which tells you how long it can be, either 40 minutes or 80 minutes, that the sunscreen will stay on wet skin. So depending on that timing, after that, you need to reapply. And then finally, when we talk about spray versus lotion, when applied correctly, spray sunscreens can work as well as lotions. However, because it's a spray, people are generally less comfortable applying it on their face because they don't want to inhale it. Also, if you're in a windy area, it can easily get blown away and end up in the air instead of on your skin. Additionally, because it typically dries quickly and it's difficult to see on your skin, you may not be able to tell where you've applied it and where you haven't. And then finally, most people don't know that you still should rub in your spray-on sunscreen.
I'd be lying if I said I haven't misapplied my spray sunscreen before. And I'm someone who burns a lot too. So that's good to know. And you had mentioned the UV rays before. So we hear UVA and UVB. So what's the difference between these coverages listed on sunscreen?
Absolutely. So, ultraviolet A and ultraviolet B, or UVA and UVB rays from the sun, are actually the ones that can reach the Earth's surface, and there's a difference in their wavelengths. I won't pretend that I know all about that or get into it, but I'll just say a couple differentiations. So, UVB rays cause a much greater risk of skin cancer than UVA, but UVA rays can cause aging, wrinkling, loss of elasticity in our skin. UVA also increases the damaging effects of UVB. So, when we talk about SPF, or the sun protection factor that's in your sunscreen, SPF 15 protects about 93% from the sun's UVB rays, while SPF 30 protects from about 97% of the sun's UVB rays. However, no sunscreen can filter out 100% of the sun's UVB rays. And that's why it's really important to also try to seek shade and wear sun protective clothing when you are out in the sun.
It reminds me, I guess I have a follow-up question. I burn very easily and all these other things, and so do my kids. So when we look at the SPF, we're like, wow, there's an SPF 120. But as you said, it's 30 or 50. And as you say that even the 15 filters out the 93%. Is it true that higher than 50 you're just wasting your money?
Yep. Higher than 50, it's a bit of a moot point. As you said, Jeff, at the 15 and at SPF 30, you're blocking out over 90% of the sun's rays. So getting to those higher levels of 70, you're really not doing much at that point.
I've also seen videos online about DIY or do-it-yourself sunscreen, and I've seen recipes that include a whole bunch of different ingredients like zinc oxide, coconut oil, shea butter, and even some essential oils. So what are the problems with these homemade sunscreens?
Well, homemade sunscreen products are risky because they are not regulated or tested for efficacy. Also, people think that the individual SPF levels of the ingredients can be additive, which is not true. And many of those ingredients actually have low levels of SPF 2, SPF 4, and that is certainly not going to give you the protection that you need from the sun's UVA and certainly the most damaging UVB rays.
Great advice. So Liz and I, it sounds like, have had the same experience with actually getting burned. So maybe we've now learned our lessons about how to apply and reapply and purchase and use the right sunscreen. But what about like aftercare products? Like, is there any value to things like aloe vera or some of those kinds of creams and gels and lotions? Is there anything you can do after sun exposure, maybe even before a burn, to help reduce the risks of sun damage or skin cancer?
Well, the first thing that the American Academy of Dermatology recommends is getting out of the sun as soon as you realize that you are burning. Other things that they recommend is taking frequent cool baths or showers to help relieve any discomfort. You can apply a moisturizer that contains aloe vera to help to soothe the skin. Also, really important to drink extra water after a burn has occurred. And certainly, we recommend talking to your doctor. There can be various levels of severity of a sunburn, so it is important to consult your clinician if you are experiencing discomfort or if you are noticing that the skin is especially irritated.
So I know Jeff doesn't allow his kids to be on social media, but as a Gen Z, most of people my age get our health and wellness information from social media. So this is why it's so concerning to see social media personalities or influencers posting on different platforms claiming that sunscreen is not necessary or sometimes even dangerous. So these posts have been seen by millions of people. Tosin, have you or your colleagues at the Rhode Island Department of Health seen these posts? And what does the department do for either procedures or policies or reactions to pre-bunk this misinformation?
Thank you so much for that question, Liz. So, we're fortunate at the Rhode Island Department of Health, like most public health agencies, to have a communications division who certainly, is monitoring the health information that people are receiving and where they're receiving it from. So Rhode does have social media and also has public health campaigns in different forms of media, as well as different languages to give the most accurate evidence-based health information to folks. And the department works with trusted community partners and organizations in sharing accurate health information.
Okay. So another idea that we've seen expressed is that there's been studies assessing the public's perception of sunscreen. So other kinds of sort of social studies. One was done by the American Academy of Dermatology, which we've talked about. It was just published this past May. They surveyed 1,000 people, young people aged 18 to 26. And again, mostly those folks using social media for their health information, and found more than a quarter of them, or 1 in 4, did not know that skin cancer can be from tanning. And so, interestingly, for a Rhode Island connection in 2018, only 6 years ago, the Rhode Island legislature, the General Assembly, banned minors, people under 18, from using tanning facilities. So, you mentioned tanning earlier. How do you feel about these data?
I think the data demonstrates that more can be done to educate the public and each other on optimal health practices to protect our health and those of our communities. Tanning can absolutely cause skin cancer. And, we have evidence, we have studies that have found that indoor tanning use can increase users' risk of developing squamous cell carcinoma, a type of skin cancer, by 58%, and basal cell carcinoma, another type of skin cancer, by 24%. And Rhode Island is not unique in that more than 40 states wisely restrict access to indoor tanning equipment, either through banning their use by minors or requiring parental consent.
Yeah, I will say I do have friends that have used them. I have not. I do not ever plan to, but it's important that everyone knows those risks associated with it. So another national study that we had looked at found that 1 in 7 adults younger than 35 thought that daily sunscreen use is more harmful than direct sun. So what's your insight into the public's perception of sunscreen, and how should healthcare professionals, healthcare students, and our listeners help to change this perception?
So I think a lot of this resulted around a 2021 study about the safety of certain ingredients in chemical sunscreens. Benzene, in particular, a carcinogen, was found in that of a certain sunscreen manufacturer. These were recalled, and there was a lot of buzz that followed this. The FDA investigated and stated that this was a manufacturing issue and not something inherent to chemical sunscreens, and still deemed chemical sunscreens, those that were not recalled at the time, to be safe. And the FDA continues to study chemical sunscreens, and other organizations continue to consider their environmental safety, such as to the coral reef. If folks are concerned, I certainly recommend that they do their research, but there is also the option of mineral-based sunscreens, hats, and sun protective clothing to continue to protect themselves from the risk of sun damage and especially skin cancer. It's so important for people to consider the sources of their information and to try to inform themselves as much as possible on accurate health information.
Well, I think that leads into one of our next questions here, is that I know the Rhode Island Department of Health, at our famous beaches here in the Ocean State, they have sun safety tables. I'm guessing that there's similar information provided there.
Absolutely. So part of Rhode's work in preventing skin cancer is to offer skin checks. These are free skin cancer screening events that are held annually at our parks and beaches, along with our community partners. So what we're looking for, a change in your skin is the most common sign of skin cancer. And this could be a new growth, a sore that doesn't heal, or a change in a mole. And if one has any concerns, they need to speak to their clinicians right away. It's also really important, and part of Rhode's work is screening outdoor workers who certainly are at high risk for skin cancer with the Partnership to Reduce Cancer in Rhode Island. And we talked a lot about education, and that's really important to Rhode. So we do that not only in the community and with outdoor workers, but also in schools, working with local school districts and schools to incorporate skin cancer prevention education into their curriculum, as well as providing banners and posters at local parks and recreation programs and other outdoor venues.
Great. So that concludes our episode on sun safety. Tosin, thank you so much for joining us and sharing your expertise.
Be sure to follow us on social media at where we get appropriate and accurate information like this podcast at PharmD Pub Health. That's Pharm as in pharmacist, PHARMD as in doctor, Pub Health on Instagram, and connect with us on LinkedIn. Turn on post notifications so you never miss an episode, and smash that subscribe button now on Spotify, Apple Podcasts, YouTube, or wherever you listen to podcasts.